Okay, guys, if you see me in Facebook Live right now, please, guys, let me know. Thank you very much. Today's session, guys, is very important session. It is a mock discussion session. The session that you're gonna learn about critical thinking, the system in Australia. Because ADC exam is just more into system. If you understand the system, if you understand the how to answer the questions, what sort of information we really need from you, you will be able to pass the exam. Exactly, guys, as you see right now on the screen, I believe you see Dr. Shiley. She is one of the champions, has passed the exam. Guys, by the way, guys, am I guys live on Facebook? Please, guys, let me know. Please, guys, if I'm live on Facebook, please, guys, let me know. Okay, Dr. Shiley, guys, she passed the exam yesterday with our 15 champions. Definitely, you're gonna be like, wow, 15, yes. And the previous result as well was about 10, 11. And the before was somehow similar. It means you really have a high chance to pass the exam with us as your family. Guys, I'm talking mainly to my champions, okay? As Dr. Shiley, guys, said, she's one of us, of our family. She's one of our Australian Dental Academy. She has done part one with us. She has done part two with us. Same like the 15 candidates, because I am the only dentist, registered dentist in Australia, who is teaching for part one and part two. Day and night, I'm with ADC. Day and night, I'm teaching and helping you. And that's why every time, if you listen to everyone has passed the exam, they always say one thing. Listen to Dr. Bidu, attend his session, write down his notes. If Dr. Bidu cough or sneeze, write down Dr. Bidu coughed or sneezed. Why? Because they know very well, they've been in this process before. They know what sort of information you must know, and the right information, not just only some notes and references. Anyone can give you notes and references. It's not about notes and references. It's about the system and the critical thinking. And that's what I'm teaching you right now. Okay, guys, let's start. I wish all my champions all the best. I know, guys, this mock it's now for everyone, but our private sessions are the most important thing. Ready, guys, for the mock before I start right now? Can you please tell guys? Okay, let me just get here. This one. Give me a second, please. Let me just go to home. And let me get the exam itself. That's good. I hope my Facebook doing good now, and I can see your comments. Yep, I can see something here. I can see you. Hopefully the comments will be updated on time. Please, guys, can these guys say hi to me just to check if the comments are updated on time or not? The last one I can see is Dr. Ayushi, and then I cannot see any comments after Dr. Ayushi. By the way, hi, Dr. Ayushi, how are you going? I hope it has been fixed. No, see the last one, Dr. Ayushi. Okay, seems like hasn't fixed, guys. Okay, that is very bad, honestly. I don't know what's wrong with Facebook, but that's okay. What if I say we need to find a way? We really need to find a way. But that's okay. Maybe if I said hi, things will be updated. No, still posting. No, those are usually the last one. Maybe something in the setting here. Write down, okay, comments. If I click on comments, still cannot see. I need to refresh, but refresh, everything will be gone, definitely. Settings, maybe later on. Later on, then I will try to find another way. But before it wasn't like this. A little bit annoying, but we need to work on all situations. Okay. I'm refreshing right now. I have no other option, just on refresh. Every time I will be refreshing, guys. Yep. Okay, guys, now I refreshed. I can see your comments. Hi, our champions. Hi, Dr. Sepia, Dr. Shama, Dr. Natalie, Dr. Zoha, Dr. Kadam, Dr. Neshma, Dr. Naindeni, Dr. Mariam, Dr. Sherry, Dr. Sayeda, Dr. Bano, Dr. Shail, Dr. Sahil, Dr. Ayushi. That's the one I have seen the last time. Dr. Wembo, Dr. Musa, and Dr. Wembo again. Wembo like rainbow. Very nice. Dr. Dara, Dr. Ayushi again, Dr. Sayed, and every one of you guys. Guys, I want to say everyone to you guys, everyone. And I hope it works right now. Now, let's start, guys, answer the questions. How was the mock, by the way, before I start, guys, going through it? How was the mock, guys? Hi, Dr. Yoni. I can see, you see, guys, Dr. Yoni on my phone, I can see she texted me on the phone. And Dr. Vijay, but not here. I will refresh every time I need to refresh. Dr. Neshma asking a very nice question. Why do we need to answer all? Why do we need to pass all the clusters? I totally agree, doctor. Why? Because that's a way. You must be good in all clusters. That's the way. You must be good in all clusters. Yes, doctor. I think Facebook now, they have lots of weird stuff happening. They're going to remove the messenger. Look, even my Facebook now, like imagine, I think now my Facebook is stuck right now. I cannot even click on the right comments or anything. Anyway, that's okay. That's okay. Okay. It was confusing. That is good. Tricky with very confusing option. That's okay. Tricky and very nice, very informative, and tricky as well. I'm very happy to hear this. Actually, great. Okay, as long as, guys, I get your feedback right now. Let's start. Okay, guys, the first question. Guys, deep breath, pen and paper. And let's, guys, answer the first question. Yes, I don't know why Dr. Les, it's same. I think Facebook really doing something weird right now in their app. Yes, same here. My phone working fine, but not my laptop. Guys, what do you think? Okay, 1 second, please. Let me guys just get the first question. Okay, guys, we have 1 hour and 30 minutes to answer this exam. Let's start. What is the most appropriate immediate management of the avulsed tooth? Dr. Mani says, I'm waiting to find out what was the correct answer to the questions. Definitely. Guys, what do you think, guys, are right? Answer first question. I see most of the answers. See, Charlie? So far, see, Charlie? We already, guys, discussed this topic, right? And we mentioned this, if you remember. What we mentioned is the question about what is the most appropriate immediate management of the avulsed tooth. A, place the tooth briefly in suitable medium before reconsider replantation. Not necessary. Rinse the tooth and proceed with immediate replantation. B, bravo, looks okay. Replant after confirming the socket and removing coagulum. See, Charlie, looks nice. Let's read the scenario. An 11-year-old boy present 70 minutes after a fall during sport. The avulsed maxillary right central incisor was located in place intermittently in the child mouth for a short period, then transported in a dry container. The total estimated extraoral time is unclear. Medical history. The medical history is not relevant that much in this case. Clinical finding, tooth 2-1 avulsed. Socket appears intact with coagulum present. No obvious alveolar fracture. Tooth has fully formed root. Visible debris adherent to the root surface. Adjacent teeth, mild tenderness to percussion, no mobility or displacement. So means no fracture. 1. Place the tooth briefly in suitable medium before reconsider replantation. Not really good answer. Rinse the tooth and proceed with immediate replantation. Good option. Reimplant after confirming the socket and removing the coagulum. Very good answer. Delay replantation until the extra oral history. No, that's a bad one. Replant after applying conditioning agent to the root surface. Which one of these guys can be the best answer? See, Charlie? Guys, now, it's outside the patient mouth for 70 minutes. Do you think guys, 70 minutes? And it was dry outside for some times. Do we need to do something, guys? Do you agree I'm not sure, guys, you tell me your opinion. Do you agree that we need rinsing? Yes. Do you think, guys, sodium fluoride is important or not? Do you think sodium fluoride is important or not? Do you guys consider sodium Fluoride, a medium or conditioning agent? Which one? I like, guys, your discussion. I look about all your answer right now. I like your discussion. And that's what I want you to do. Yep. Guys, how we call fluoride in this case? How we call it? Conditioner or medium? The fluoride treatment. So is it conditioner? Is it conditioner a conditioning agent, or is it a medium, suitable medium? Okay, guys, make it easy to you. I got you guys. I made you to answer by yourself. I made you discuss the stuff, right? Guys, do we call fluoride as conditioning agent? No, it's not conditioning agent. Do we call fluoride as suitable medium? No. We don't call it as suitable medium. How we call it? We call it fluoride treatment. We call it fluoride treatment. Guys, am I clear about this point? Very good. I'm very happy, guys. You got this point right now. Now, option A, not correct. Option E, not correct. A, alpha. E, echo, no, correct. Now we are between B and C and D. Let's exclude D delta. Sorry, guys. I will spend a little bit of time on the first question. I will, guys, spend a little bit of time on the first question, right? Because I wanna teach you a technique, how to answer. B Bravo rinse the tooth and proceed with immediate reimplantation. B Bravo is perfect. Let's, guys, please agree on this together. Yes, doctor. Okay, Dr. Sayeda. Everyone, please, guys. Can I please, guys, ask you for guys. Guys, can I ask you guys for a favor, please, guys? Please, guys, can I ask for a favor? Please, guys, if you have any question, can you keep it, please, guys, until I finish the question itself? Because I don't want to miss any of your question, guys, okay? unless I finish the question completely, I answer it, then I will start to take your question, or at the end, which I prefer at the end. Okay, guys? Good, guys? Can be good? Okay. The second point, is it there? Is it there? Is it there, guys? Is the tooth less than 60 minutes or more than 60 minutes? So it's more than 60 minutes. Do you think the periodontal tissues, guys, in this case, do you think the periodontal tissues will be vital, non-vital? Non-vital, right? So option B, sorry, in this case, the periodontal ligament will be non-vital. So option B, not important. Why? Because immediate reimplantation after 70 minutes will not make any sense. We still need to treat it. Now, the only thing left for us, C and D. C, reimplant after confirming the socket and removing the coagulant. Very good. We definitely need to do this. Now, that's the right answer so far. D, delta, delay replantation, and the external oral health. Wow, C now is the right answer. Look, guys, I told you, I will take a little bit of time. I will be taking a little bit of time, guys, just to show you what can happen in exam. Do you know what I'm doing right now? I'm your brain. Right now, I'm acting like your brain, exactly in exam. Right? Your brain is gonna be work like this. Very good. Right answer, guys, E echo. Everyone got surprised right now. Right answer is E echo. Everyone gonna be surprised, but I have done exactly what's happening in exam when you have these options. And now I'm teaching guys the critical thinking. How is this? Let's look at it now, guys. Place the tooth briefly in suitable medium before reconsidering replantation. Nope, you don't need, because the patient already in the clinic. You don't need. You need to act quickly. Be bravo, guys. I have done exactly like your brain. Exactly like your brain exam. B option, rinse the tooth and proceed with immediate replantation. The word immediate is wrong, because when 70 minutes has been already elapsed, you don't need to do immediate. We do immediate in the first 60 minutes before 1 hour. But when it's already 1 hour is gone, most probably the root is not actually the bulb tissues, sorry, the periodontal ligaments, Most probably it's necrotic. Replant after confirming the socket and removing the coagulum. Perfect. But E comes first before this. I need to do E before C. Delay, wrong. E. Replant after applying condition agent. Yes, guys, fluoride, it can be called a treatment as a treatment. Fluoride treatment can be called as a condition agent in these cases. So we do this one first because the question, what is the most appropriate immediate management now? Do this. After you do E, you do B. Then apply condition first, sodium fluoride. Then rinse the socket and proceed replant after confirming the socket and removing the coagulum. But E first, C second. Clinically based, guys. Guys, that's a way you need to build up your critical thinking in exam. Imagine yourself, you are in the clinic. So the answer, guys, E echo. Guys, is that guys clear so far? Sorry, guys, I had to spend a little bit of time for the first question just to explain to you. Yes, we consider as a condition to the root. We condition the root. Clear now, guys? Should I move on right now? Thank you. Dr. Zoha said clear. Dr. Pavin said clear. If someone else said clear, like Dr. Shama, now I can move. Thank you very much, guys. Second question. Guys, one thing, guys, answer side question, please, guys. In preparing the avulsed tooth for implantation, which approach is most appropriate? Dr. Nadia, Dr. Nadia, I already explained it. Maybe at the end, if you want me to explain it again, I'll explain again and that because I asked the candidates and everyone said, keep going, doctor, okay? Maybe at the end then. For all that is, Dr. Mani, for all that is, Dr. Mani. Guys, what's the answer, guys, this question? Yes, Dr. Nandin, yes. Guys, please, guys, need to be quick when you answer. So in this case, I can have some time to explain more. Answer, guys, for this question is the one we didn't choose it in the first question. B bravo is the answer here. A is wrong. Rinse briefly while gently dislodging loose debris with fingers. No, we don't use fingers. A is wrong because we don't use fingers. Rinse briefly in suitable medium, yes, like milk, for example, without attempting to remove adherent debris. Very good. Like be gentle. Don't scratch too much. Be bravo, guys. Don't scratch too much. C. Rinse thoroughly until the root surface appears visibly clean. No, that's gonna be too much. We need to keep a little bit of ligaments, right? We cannot remove all the adherents. We cannot, guys, right? Need to see the visibly clean because if visibly clean, it means you're gonna remove all the periodontal ligaments. Even if any periodontal ligament inside, you will remove it. The word visibly clean. Rinse briefly, followed by light wiping with gauze. Wrong. We don't wipe by gauze. Rinse and allow the root surface to dry slightly before implantation. We don't want to make the root too dry. Okay. So rinse thoroughly until the root surface appear visibly clean. Okay. I know you may get confused between, say, B and C, right? Yeah, which is normal, definitely, if you get this confusion. But you shouldn't clean it, guys, totally. Okay. Guys, do you have any question here? Guys, I'm very happy, guys. Take your question, guys. If there's any question, please, guys, tell me. I'm very happy now. Take your question. Let me check. Clear, doctor? Okay. Okay, guys. Clear? Okay, guys. Let's keep going now. Next question, please, guys. Question 3. Yes, answer is B. Guys, the only problem with this one, when, guys, we rinse it, we just rinse it, guys. Right? To remove, this is more accurate than C. Rinse briefly in a suitable medium without attempting to remove adherent debris. Because some adherents into the tooth itself, because, guys, we have two types of debris, guys. We have loose debris and adherent debris. What sort of adherent debris? It's a part of the tooth. Be bravo. Like, okay, guys, now I will explain this one in details, guys, okay? Now, adherent debris. What does it mean, adherent debris? Do you think the debris which is coming out like soil, or adherent means periodontal ligaments? You see, guys, that's exactly what can happen in exam. In exam, guys, your brain gonna be like this. Now, guys, the word adherent debris. Do you think the debris existing on the tooth adherent to it? That will be periodontal ligament is adherent or not adherent? Any other debris on the root will be loose, like soil, right? In this case, do we remove, guys, do you want really rinse the tooth until you see the surface visibly clean, like there is no periodontal ligament at all? Do you like, guys, to remove the debris, which is the periodontal ligament? Now you can see the surface, the root surface, under the periodontal ligament, visible without periodontal ligament. So in this case, guys, I don't think that's gonna make sense, right? So we clean it nicely, briefly, gently, right? And then we're gonna place it in sodium fluoride. And then sodium fluoride will work as good treatment and then conditioning and then will actually make the things much better. Did you get my point? I hope, guys, that's clear as well. I hope now it's clear, okay? Yep. Question 3, please, guys. Very good. I'm very happy. The right answer now, guys, C, Charlie. For this one, I think it's easy. I can keep going now, right? I'm very happy, guys, with this. All of you right now, guys, you did really the right answer for this one. Yes, C, Charlie, the duration. Or A, alpha. Now, like everyone, oh my God, which one? The total time that the tooth remained outside the socket. Or the sequence of, or C, the duration of the tooth remained dry. Imagine, guys, the answer A, alpha. The total time that the tooth remained outside the socket. And C is good. The duration, the tooth remained dry. Why? Because when we consider still milk is good, right? And the media is good. But outside the socket, either in the milk or without milk, for example, the total time the tooth remained outside the socket, considering both things. That's, guys, concept we guys, the right answer is A, okay? That's, guys, what we consider as general option, much better than specific option. One option has another option in it. What does it mean? Look at this. The total time, total means two things. In storage media plus dry time. Let's say right now, if we placed a tooth for 1 day in storage media, if this is something make the prognosis good? No. So the total time the tooth remained outside the socket, because if the tooth remained outside socket, it can be in two places, no more. In storage media, like milk, or in dry, not in milk. Now, doctor, option C is good. The duration the tooth remain dry. Yes, it's here. So option A contained option C. That's a technique called a general option better than specific option. Option A general has two things in it. Has storage media, has dry time. Option C only has dry time. So that's why option A is much better. Guys, did you get, guys, this concept, guys? That's why I'm telling you, believe me, guys, exam like this. Exam needed to be smart with clinical experience, clinical knowledge, evidence-based. And trauma guidelines, in Dr. Anderson's book, in TG, all of them, they talk about these 2 points. But which one more important clinically? A. Because if the patient placed the tooth in a milk for a day, it's not dry. But I don't think milk can preserve the tooth for a day. And then outside the socket can be dry as well. So now A, much more important than C. Guys, am I clear, guys, about this right now? Answer A. Dr. Ayushi says, when I solve with you, I answer correct. But when I solve alone, I answer all wrong. Give me your brain, Dr. Bido. You're very smart, Dr. Ayushi. We just only need to focus in this part only and think more clinically, as if you are in the clinic and you think about it. In the clinic, when the patient comes to okay, guys, I will give you another idea. You don't know anything. The patient came to you, they give you the tooth. And now, 2 patients. One patient told you, doctor, I put my tooth in milk, not dry. Another one told you, doctor, I put my tooth in milk. Both of them. Not dry, both of them. The first one told you, doctor, I preserved the milk for 2 days. The other one said, I preserve it in milk for only 30 minutes. Are you gonna manage the 2 teeth similarly or differently? And now it's not dry. We're not talking about dry time. What do you think now, guys? Now tell me, do you think the both of them will have the same prognosis? Should I, guys, give you this example again? Exactly, not clear? Okay, let's, guys, do this example. We have 2 people. That's, guys, the patient, okay? Both of them, they put it in milk. That's, guys, milk container. That's milk. They bought the tooth. That's, guys, the tooth inside the milk, right? This one, put it only for 30 minutes. And this one for 2 days. Is it dry? No, not dry. We're not talking about remain dry. We're not talking about this. We're not talking about this option. We talk about this option. Do you think the prognosis for this one same to prognosis of this one? Thank you. Did you get the idea right now? Not only about dry. Dry is good. I'm not against dry. But A, it has a total time, dry and not dry. I hope, guys, it's clear right now. I'm worried about timing, okay, guys? Answer is A, alpha. Thank you. Let's, guys, go with the next question. Guys, we have only 1 hour to finish the rest of the questions. I'm trying to help. Dr. Bido, but why dry time is more crucial than the... Yes, definitely. It's more crucial. It doesn't say, okay, the question doesn't say, right, more crucial, right? Both of them, it's important. Both of them, guys, significantly limit the ability to determine prognosis. Yes, both of them. A and C, but A, it has more, it still had the effect of, like, it's still important as well. Question 4. Question 4, guys, as you see right now. Now, you're going to do reimplantation. Apply passive flexible splint. Very good. Short period with planned review. I'm happy with this option so far. Use semi-rigid. No, we don't use semi-rigid because no fracture. Apply a flexible splint an adjacent duration based on symptoms? No. Avoid splinting unless mobility becomes evident? No. Use rigid splint initially and modify later. A alpha. Guys, this question is clear. Can I keep moving, guys? Guys, this question, guys, clear? No questions for me? If I see 3 champions say yes, I will keep going. If one of the top 3 said no, I will stop. I see the answer A. Yes, clear. Dr. Sharma said yes, clear. Dr. Anum said yes. And Dr. Pater said yes. I keep going. If alpha bone fracture, doctor, use rigid splint. Dr. Cecilia, your name is reminding me with Dr. Cecilia names. She passed the exam as well, Dr. Cecilia. So it's a good luck for you then. Good sign. At a review, the replanted tooth is asymptomatic and non-responsive to sensibility testing. What is the most appropriate interpretation? What do you guys answer here? I'm very happy, guys. Everyone say yes, and there is no questions. Means I'm very happy, guys, when you got the things right and easy. I see now, guys, the answer between C and D. C and A and B. And A again. Okay, lots of answers. Now, A indicates early pulpal necrosis requiring immediate treatment. No, guys. We don't do this unless we have at least two signs or symptoms of infection. If the tooth is non-responsive and asymptomatic, we just consider the tooth is still in a shock, right? And then we still need to follow up more. The key word at early review. But what if we see the tooth non-responsive and symptomatic means painful, and symptomatic? Now we may start to do immediate treatment. So not A alpha. I hope, guys, it's clear right now. B option. If you have chosen B, listen to me, please. Suggest a transient pulpal response following trauma. B bravo. Looks really very nice. Very nice option. Wow. This is true. Nothing wrong in it. Let's check C. Remains inconclusive and should be monitored before intervention. Likely represent, guys, B and C, keep them aside right now. Likely represents early necrosis, but may not yet require treatment. D delta, perfect. Perfect. Keep B and C and D aside right now. May reflect unreliable sensibility testing. At this stage, E echo, perfect. The only one is wrong, A, but B and C and D, all of them correct. Now, think about it clinically, guys. Right? Which one of these, the thing, it can be helpful to you and you still need to do it. Like without it, you cannot proceed. Not just some information, which is correct information, but also a clinical step you must take. Which option, guys, between, not A, forget about A. A is the only one wrong. But this correct, this correct, this correct, this correct. Okay? One of these four, they are clinically based and they will help you for the next steps. Clinically, you need it. Clinically, you need this option. Without it, the treatment cannot be done or that you cannot proceed further. I love your answer now, guys. Dr. Kadam say, Dr. Adam Bidu, very tricky. These are the way we have the exams in Australia. They talk to you, they actually test your critical thinking as if you are in the clinic right now and you need to choose the right answers. I'm very happy, guys. I'm very happy now. I'm very proud of you. Now you got it. You start now to learn the concepts. See, Charlie, be corrected, C corrected, D corrected, E correct, but the best C. Why? Because for me, even though we all know that's a transient, that is transient pulmonary response, we all know that necrosis may happen. We all know vitality test is just a baseline test that is it is unreliable, but C is the conclusion. Remains inconclusive. B inconclusive. D inconclusive. E inconclusive. That's why, as a dentist, you should monitor before intervention. Dr. Sharma say, this is how I felt during my exam. Very good, doctor. Next question, please, guys. Well, we have less than an hour now. Next scenario, please, guys. You're a dentist, experience community health. Okay. Sandra, 55-year-old woman, new patient missed a dental appointment. She owns a cat. Lovely. She seeks your recommendation. Very good. Now, what is the best advice you can give her? Guys, what was your answer, guys? You read the exam, right? You read it. You read this one. Guys, what is the answer here? You are a dentist with experience in community oral health, and you have been invited to speak at local church about oral health care, common dental concerns, and dental care for all the adults. Your goal is to educate the community and maintaining good oral hygiene. Okay, during the session, several attendees raised important questions regarding their oral health. Sandra, 55-year-old woman, patient made okay dental appointment as she was shown admitted for 2 days for surgical excision of squamous. Oh, sorry for her. She owns a cat. Okay. She seeks your recommendation on how. Okay. Now, arrange for professional pet sister or boarding service. That is too much and very expensive. What do you think, guys? Right answer. See, guys, your answer between B and E and A. I see, guys, your answer between A and C. Like between A and B and C and A, right? B, inform her the pet care is outside your scope. No, that's very bad. That's very rude. B is very rude. If you are a dentist and tell the patient it's out of my scope, it means like you're really rude. Like I don't care. Try to help. Ask a neighbor to check on the cat. Cat, guys, for some people, guys, did you choose C, Charlie? I tell you. Okay? Dr. Marcella said, I want to say because Israel really loves pet. I'm happy. But it's not about what if your neighbor not Australian? What if your neighbor is different nationality? I don't know which nationality it is, right? And then, guys, some people they consider a pet like the cat, like your baby, like a son, like a baby, like a daughter. They call them like, I am your mom, I am your dad. I don't know. They keep saying this to the pets, right? So now, do you think these people they can leave the pet, the cat, to a neighbor like a son, their daughter? No, they cannot. So don't definitely, guys, don't trust the neighbor, right? Don't trust this way with this stuff. We need to be professional. Inform, inform the hostel staff about the concern, and they may have resources to assist here. They may say, we don't care. Like it's your responsibility. Ask you, you must the one take an action. Contact local animal welfare organization for temporary pet care assistant. Contact a local animal. E looks nice for me. And A, right, guys, remember when I said it, when I explain something about A looks nice as well. A and E, the best. Two answers. Okay? And professionally, we go with A. You just talk to her and ask her because it's her responsibility still, but we advise her. Right? It says because I'm a dentist, I still need to help her in professional way. In this case, what we will do is we can ask her to arrange for professional pet sitter or boarding services for the cat during her hospitalization. Right? The word temporary pet care assistance for echo, it does not make that much sense. The word professional pet sitter, it does make option A correct. Guys, in Australia, we have professional pet sitter. We call it as boarding service. And like, for example, guys, you can check this by yourself. When the patient comes to the clinic, we tell them to contact the RSPCA. This is, guys, exists because I'm New South Wales right now. They can contact the RSPCA New South Wales. Okay? They can contact the Animal Welfare League. That's another one. Right? So, guys, option A is the correct one. Guys, is that guys clear so far? So, option A, alpha. Arrange. Guys, the question asked about what is the best advice you give her? My advice is I will tell her, Sandra, arrange for a professional pet sitter, Sandra, or boarding services. Do you want the name of these people? Do you want the phone number? I can help you with this, but you are the one going to contact them to ensure what's happening. Okay, guys, I will take your question right now. I see some questions here. I will take them. From this, I have a question. Are assistant dogs allowed in hospitals and dental clinics? Yes, Dr. Nayandini. Dr. Bidu, did A. I did A, but you made me confused. I wrote down the notes. I will be, don't, no. Look, again, as I'm saying right now, I discuss with you options. I'm thinking like you, like a candidate when I answer the questions, just to show you guys how you answer. Take my last answer is a confirmed answer, okay? Because I keep talking loudly as if I'm one from you, as if I tell myself that's correct, that's wrong, until I read all the options and then I say that's the right answer after I read the 5 options, okay? No problem. Okay, guys, great then. I'm very happy for this. So, guys, answer A alpha. Next question. Okay, Dr. Anna says A sounds better as I contact them to help. A is to arrange for her. Okay, E, if you're gonna contact them, doctor, you still need to be responsible for many things, like to give them information, all this stuff. It's much better to give her advice first, to arrange, but this is the first step. If she says, no, I cannot, can you please help me in this? I tell that's fine, that's fine. Give me the information, I will be trying to help in you this, okay? Okay, guys, this question, please. Michael recently purchased a new water jet. Guys, we have something like we have water jet, like water floss, okay? Which the manufacturer claims in highly effective, it is highly effective for oral hygiene. His wife, Sarah, is skeptical in it about the efficiency compared to the keyword here, guys. The keyword is compared to traditional flossing. Now they really need advice. A, water jet are more effective than traditional floss. Wrong. A is wrong. I'm thinking, guys, like you right now. Water jets are not effective in cleaning between teeth and removing plaque? Question mark. Copyright. Gingivitis is a reversible inflammatory condition caused by plaque accumulation along the gum line. True, but not relevant. Not relevant. Answer to the patient's concern. Now we learn one new concept here. That's, guys, what we call it as train station and kebab shop concept. What does it mean? Patient has a concern here. The concern is, doctor, I need to know which one do you, like your wife, okay? Your partner asking you, which dress is good? The red dress or the white dress? You tell her the black shoes. She's gonna kill you. She's gonna shoot you, right? So if you have chosen C Charlie, means you have chosen the black shoes to your wife. So that's wrong. Irrelevant. However, it's true. Dr. Anum knows. Dr. Anum said it's a kebab and train option. Water jets are commonly used in dental clinics. No, we don't do this. No, it's not. We don't do this. For periodontal therapy, no. How come we use water jets for periodontal therapy? No, we use curette. Water jet should replace tradition. No, that is crazy. The best answer, guys, be bravo. Not as effective. Not effective, guys. Why? If you're telling me it's effective, you know what should I tell you? I tell you, okay, don't do floss then. Don't brush between the teeth then. But if you say floss is effective, definitely floss is effective. So the option, guys, be bravo. Guys, is that, guys, clear to me? Guys, sorry, guys, is that, guys, clear to everyone? Guys, please, guys, if clear, tell me clear quickly. We have no time. Say clear. 3 clear, guys, I can keep moving. 3 clear, I can move. Why not A? Because it's not more effective than traditional floss, doctor. It's not. Okay? Clear. Dr. Amir say clear. Dr. Rajesh say clear. Dr. Musa say clear. Okay, let's keep moving then. Next question. Now, guys, a 28-year-old man has been prescribed ibuprofen but is unsure how to take it. until he sees you for root canal treatment. What is correct regarding concern? What do you think is the right answer? Guys, I want to see every one of you guys pass the exam like our champions, guys. They passed yesterday. I really, guys, want to see all of you guys pass the exam. Please, guys, and you write down notes. Very good. The answer, guys, is B. Bravo. Before our old concepts, we used to say you cannot take ibuprofen on empty stomach. From 2022, they changed it. About 2020, 21, 22, that COVID time, around COVID time. They said, no, you don't need to eat food. You can take it on empty stomach. So guys, answer is B. Bravo. A option, ibuprofen must always be taken with food. Wrong. That was old. These days, no. B is correct. C. Experiences gastrointestinal bleeding, he may take ibuprofen with food to reduce. No. If the patient has gastrointestinal bleeding, they shouldn't use ibuprofen. Okay? Very tricky, very tricky. Taking ibuprofen may increase bleeding after extraction. In its own, not really. Like one ibuprofen, two ibuprofen for a few days, going to extract the bleeding, less likely. And by the way, the questions about they should take it or not. Ibuprofen is non-steroidal anti-inflammatory drug commonly used in pain relief. Again, distractor. Patients has an issue with this one, with B. Bravo. Okay, the concern is B. Bravo. The answer is B. Bravo. The rest not concern. So guys, answer B. Bravo. Guys, can I guys keep going, guys? Yes. Okay, now guys, everything? Thank you. Next question. What guys do you think the answer for this question? The question is, Mariam, a 60-year-old female patient, has type 2 diabetes mellitus, managed with metformin. Okay. And osteoporosis. Oh, okay. She expresses interest in dental implant treatment. Okay. But mentioned that the dentist overseas told her implants were impossible. In her case, she seeks your opinion on that matter. A. What think is the right answer? A. Dental implant can be given in diabetic patients. Yes, no problem. But they are absolutely contraindicated in patients with osteoporosis. Wrong. This is wrong. The word absolutely made it wrong. It's relatively contraindicated, not absolutely. So wrong. Due to her medical conditions, dental implants are not an option to her. Wrong. Option A, and here, guys, we're gonna use a technique called exclusion technique. In this question, we're gonna use a technique called exclusion technique. A and B, they are the same things. Exclude A, exclude B. C, implant can be placed with proper assessment and medical optimization. Very good. Why not? Even patient has diabetes. Why not? Control diabetes. Patient has osteoporosis. Patient on medication. Medication is good. There is no problem with this. maybe wrong will be managed. No issue. The patient with osteoporosis should never receive dental wrong. Should never wrong. Option A and B and D, the same meaning. The previous dentist was incorrect, and she should consider removable denture. You cannot say correct or incorrect because you don't know what has happened. This is not ethical. This is not ethical. So that's why option is wrong. Guys, is that guys clear so far, guys? The answer is C, Charlie. Clear so far? Very good. Thank you, guys. Question 5, Manny. What is guys the answer for Manny's question? How's the mock with you guys so far? Interesting, right? I believe that's the first time you think this way. And that's, guys, the way you need to think for the exam. Guys, man is concerned about hard deposits. There's a TATA, calculus. Guys, TATA mean calculus, okay? Accumulating on the dentures. So what is the most appropriate recommendation, guys? A. Soak the denture overnight in dilute white vinegar. Yes, this can, as long as there's TATA or calculus, we need to soak the denture in dilute white vinegar as long as there's TATA and calculus. A is correct. B. Brush the denture twice daily using a denture brush or soft nail brush with mild soup and warm water. Warm water made it wrong. Warm water made it wrong. B is gone. It should be cold water, running water. And also, not only wrong because warm water, because when there is tartar and calculus, brushes cannot remove. Guys, the whole idea is about this. Denture has calculus. Calculus is hard. Patient cannot see you. If the patient use just soft brush, calculus will not be removed. We need to use white vinegar to kill the bacteria colonies inside the tartar, the calculus, and also dissolve calculus. That's why A. C. Avoid using hot water. Yes. Toothpaste, detergent, or abrasive substance when cleaning denture. No. We don't. Guys, we use detergent. We use detergent. Toothpaste, maybe, if not abrasive. We like soap better, right? So avoid using hot water, maybe. Yes, that's correct. This one correct. Avoid using it. Correct. Right? Toothpaste, maybe yes, maybe no. Like somehow, it depends, has abrasive or not. Detergent, no. You still can use detergent. You can still use soap and detergent. Abrasive substance when cleaning denture? Yes, abrasive. So that's one, make it incorrect. If deposits persist despite home care, consult dentist for professional cleaning. If deposits persist despite home care, consult dentist. This is very good one, by the way. D is still good. A is good. D is good. Let's now discuss which one is better now. Store the denture in a dry place. Wrong. Totally wrong. So now the only two options can be correct. A and D. A and D. Right? In this case, Manny is concerned about how deposits accumulating in their dentures and asks for advice on how to manage it. What is the most appropriate recommendation based on best practice? A. Soak the denture overnight in dilute water, dilute white vinegar, the solutions, which is A. D. If deposits persist despite home care, consult dentist for professional cleaning. Right? You know what? As a priority, right, guys? As a priority, a question. Sorry, guys, I take this question right now. What is question? This is. How did you money? Where's money? The patient money? Dr. Karan, yes. We advise the patient to keep it dry, but if there is tartar, we ask them to put it in an if tartar, we ask the patient to put it in white vinegar. Yes, we don't soak it in water. We don't make it wet, but still you can keep it if there is tartar. Only if there is tartar. Only if there is calculus. Okay, guys. Now the best guys, the best things is A alpha. Soak the dentures overnight in diluted white vinegar solution, and then clean them as usual. Now will be dissolved, and then maybe calculus will be removed by this way. So that's the first things. Then if this practice doesn't work, we go with D delta. So A first, then D delta. So what we tell the patient is, if this is happening, soak the dentures overnight in dilute white vinegar, and then brush it nicely as usual, and then see what's gonna happen. If it has been removed. If it's not removed, option D will be correct now. If deposit persists despite home care, you see, guys, home care, we give it in option A. Despite home care, consult dentist. So A, then D. That's just called priority. That's called priority. Okay, guys? This is called priority. Because not all the calculus will be hard to remove with white vinegar. Okay? So option A and then D. Next question. Guys, only half an hour left and still we have 3 scenarios. Oi. Question 1. Question 1. What is the first step, guys, in extract 216? You see, guys, you say right now, tricky questions, and I believe you, tricky questions for you at this stage. Once you have clear mind and then good clinical thinking, you understand more about ADC exams and understand more about the logic here in Australia, you will know all this concept by heart and you will be perfect after sometimes. Okay, guys, now you need to extract this tooth. What is the first step, guys, in extract 216? The first step, guys, to extract any tooth in this world, after you give anesthetic is to use small straight elevator to do laxation, A alpha. I see all of you guys answer correct. And I'm happy with this answer. And I believe we can keep going. Guys, is that guys easy to everyone? Before we apply forces, we need to laxate. A alpha, E echo, conduct a pre-extraction radiograph to evaluate. We already have the radiograph, doctor. E echo, we already have a radiograph. So I don't need to take another radiograph. Okay, guys, clear now, guys? Can I move? Yes, so the first important thing, guys, yes, Dr. Sayeda, I already explained this one, already had the radiograph, doctor. Okay, next question. If laxation is necessary for the whole tooth, what is the primary and the correct statement regarding the proper use of laxator, guys? How will you use laxator, guys? By the way, all this information you will find it in Delicious once we start the surgery subject. Okay, so later on, we're going to discuss about the surgery subject in order, and then you will find all of this in Delicious. Delicious, guys, not just notes and references. It's not. It's beyond than this. Delicious. They are really delicious. You can see this once you. I know, guys. Now you have seen some of them, and I believe, guys, you love them, right? I see the answer now between C and A and B. Right answer, guys, is A alpha. We place the laxator in periodontal ligament space and apply gentle apical pressure to loosen the tooth. We place the laxator here in this area. And this area, and then maybe buccally gently. Between the tooth and buccal gently. And then we just wiggle a little bit apically. Guys, we're not talking about the whole root. We're only talking about the crown area, okay? Option B, use twisting motion. If you do twisting motion, you're gonna loosen the adjacent teeth. I don't want you to loosen the adjacent teeth. C, the laxator blade should always face the root being loosened. Not necessary all the time. It's not necessary all the time. Laxator blade should always face the root being loosened. By the way, in this case, guys, we're not losing roots. In this case, we talk about the whole tooth 1/6. So option C, irrelevant information to the question, because the question asks about if you're going to lose the tooth. So what you need to do? I need to do A. C, if the case about remaining root, the case not about remaining root. So C is not wrong, is not right. Gradually increase the depth of insertion while maintaining a steady pressure. Until where? Until where? Until where? Where are you gonna stop? Direct the laxator toward the patel aspect for better leverage. No, that's anything, any the structure. Option guys A alpha. Question 3. Now we talk about a root now. If apical third, 1/3 of the root fractures, guys, is very tricky one. This is very, very tricky. There's concern about pushing the root into the sinus. Which of the following elevator carries the highest risk of causing displacement and should be avoided? Which one of these should be avoided? Which one, guys? Okay, now guys, think about it. If you have a remaining root inside and close the sinus, and we say close the sinus, right? In this case, the question is about you are worried to displace the root inside the sinus. Which one of these will be displacing the root inside the sinus? The one you're gonna use it with apical pressure. So which elevator of these will use with apical pressure? We're talking about displacement of the apex to the sinus. Like this, for example. Like this one. You displace the root inside sinus. So which one can result in this? A. A can result in this. Why? Because when you place like this one, look at this. I think I found something here. I have seen something goes there. Yeah, like this, guys. Look at this. Exactly. You guys can read this article. If you're going to use Laxeta, A alpha, right? Copeland elevator, like this one. The guy is Copeland, like this. Copeland elevator, like this elevator. You end up, there's a high chance to push the root inside the sinus. But what about Crya? Crya has a triangle plate. You will not push it inside the sinus because the movement is like X and Y, rotational. So in this case, what can happen if you use cryo? You end up breaking the bone, but not pushing the root inside the sinus. You're breaking the interdental bone, but you will not push the root inside the sinus. That's why, guys, answer is A alpha. That's, guys, the answer for the question. A alpha. Okay? Dr. Karan mentioned C is more aggressive. I totally agree, doctor, about this. But C will remove the interseptal bone. The question asks about causing displacement inside the sinus. Cryer normally will not end up with displacement, but is aggressive. It may break the interseptal bone, but not pushing the root inside sinus. Is that, guys, clear right now, guys? Difference between A and C? Answer is A. Question 4. What is the most appropriate to check for sinus perforation? Thank you, Dr. Ashik said yes. C, Charlie? No problem, Dr. Karen, yes. C, conduct clinical inspection for visible sinus communication. I love this. Guys, it's all about visible, right, guys? Use our eyes visibly. Perform VASVA, guys, we don't do this one anymore, wrong. Use suction to check for bubbling of, no, that is even bad. You're gonna increase the size. A and B, both of them, they will increase the size of the sinus, the oral communication. C is very good. Palpate the soft tissues around the area for crevices. No, this is irrelevant. Take an immediate cone beam. No, not all the time. Not all the time. C, Charlie is the best answer. Guys, is that guys clear, guys, to you right now? C, Charlie? 19 minutes left. Guys, that guys clear to you guys? Why C, Charlie? A, it may increase the oral-antral communication size. B may increase the oral-antral communication size. So not A, not B. Someone mentioned TG. Yes, you will find in TG. You will find it in Bedilicious. You will find it in diamonds. You will find it everywhere. Guys, can I keep going? Yes. Okay. Thank you, guys. You said yes. There's no question. 5. If the root has displaced, how will you manage? Oh, if guys the root is displaced, you know what's gonna happen? You're gonna cry, right? If the root displaced, you're gonna run away. You're going to cry. True? Guys, that's an easy one. If the root is displaced, we need to refer the patient to a specialist. Be bravo. Refer the patient to an oral surgeon for surgical retrieval via a cold will look procedure. Be bravo, right? Attempt. No, you don't attempt. Wrong. A alpha is wrong. A alpha wrong. Prescribe antibiotics and nasal decongestant to. This is not priority. This is not priority. B is priority. Educate the patient to avoid nose, not priority. However, correct. Perform endoscopic, again, not your job. Not your job. So the answer, guys, B, bravo. Anil. Anil Sharma. How many questions left? 10 questions, 17 minutes. Guys, quickly. Based on the clinical findings, what is the most accurate diagnosis for Mr. Sharma's periodontal conditions? By the way, guys, from today, based on our structured daily plan, based on our structured daily plans, from today, we announce this on Telegram group as well. From today, you need to start perio subject, okay? Yes, and from now on for the next 3 days, I'm going to help you in this. I'm going even to I'm going to even answer questions and post a question regarding perio. You're very good, guys. I'm very happy. All of you answered this question correct. Wow. How, guys, all of you guys answered this question correct? You guys, perfect. Yes, guys, stage 2. Why stage 2? I'm very proud of you. Maybe because we discussed this one before. I guys explained it before. Why, guys, stage 2? Stage 2 because the pocket depth is just 4 to 5. You remember we said 4, 5. We said 3, 4, 4, 5, 5, 6. Do you remember? Yes, and then we said 4, 5 means stage 2. What about grade B? Grade B because the patient smokes less than 10 cigarettes. The 0.45 pack year history means this patient, these guys we use in Australia, means this patient use about less than half pack. Half pack means 10 cigarettes a day. Guys, know this, write down this information. Half pack smokes 10 cigarettes per day. Less than half means that less than 10 cigarettes a day. So answer, guys, be bravo. Perfect. Dr. Zoha, because of your wonderful lecture on this topic. Thank you very much, doctor. Your lecture on classification as magical. Thank you, guys. I really, guys, very happy about this. Yes, Dr. Amin, half pack means less than, like about 9 cigarettes. About nine cigarettes per day. Half pack a year means 10 cigarettes per day. Okay. Dr. Musa says that's the only question. I was sure for option B. Believe me, This is like once we study all the stuff the way we discussed Perio, once we discuss everything, you will be perfect. Perfect. Don't worry. Okay? You just guys at the start of the course. Okay. Guys, be bravo. Next question. Which grayscale rate would be most appropriate for the briding the mise and this service of 216? Okay, guys, let's make this right now. For Gracie, guys, when we do curettage, we divide the mouth into sextants, like this. The first sextants until the premolar. Guys, like, I will do it like this. The second sextants until the between the key 9 and key 9, like this. Now we call this one O. Okay? So, guys, we do 6 and 1. Sorry, that is 2. This is 3. This 4. This 5. This 6. This 6. Sorry, guys. 6 like this. Whatever. Okay? Now, all anterior, like 1 and like 2 and 5, we use Gracie 1, 1, 2. That's, guys, only one key rate, okay? 3, 4, 5, 6. There are 3 key rates right now. 1, then the 1 and 2, 3, 4, 5, 6. That's for all anterior. What about 7, 8, and 9, 10 for posterior, but buccal and lingual? What about 11, 12, 13, 14? That's, guys, look, there is 16, 17. Forget about this. 16, 17, 18, 19, the stuff. Forget about them because they are modification of 11, 12, 13, 14. Just to keep until 11, 12, 13, 14, classical ones, and understand them. Now, 11, 12 is for mesial, for posterior. Doctor, how I know? I'll make it easy for you. 11, if you make 11M, will be mesial. Easy? So now, 11, 12, and 13, 14. They are both right for posterior. One of them is mesial and one of them is distal. How can I differentiate them? Make 11 to be M. Now it's mesial. Okay, guys, so 11, 12 mesial, 13, 14 distal. Okay, so now the question asking about 1, 6, which is posterior teeth. And then they ask about mesial. So now we choose 11, 12. Mesial and distal, or mesial only? Mesial and distal. So now we talk about 11, 12, 13, 14. See, Charlie. I hope guys clear. Can I guys keep moving, guys? Only, guys, few minutes left. Easy now, guys. Can I keep moving? By the way, guys, once you write down all this concept and listen to this class either on YouTube or on Facebook and keep revising what I said, and you look at Bit Delicious, or you look at TG, or you look at a proper reference, you will not just only learn. Guys, just the guys going to learn the answer of these questions, but you will learn the answers of any other question will be asked in the future. Some Dr. Johanna say Kranza. We don't need to read Kranza anymore right now, Dr. Johanna, because it's too much. Definitely, if you're happy to read it because you used it before, I'm happy for this. But all of this, you will find it in Bidu Bytes in Perio. Bidu Bytes in Perio. Even much but explain much better than any, like, very well explained. Guys, what should be the correct insertion, guys, angle? Okay. The correct, guys, insertion angle, I'll explain this to you. First, why Gracie? Gracie, she's a very smart lady. She said every time when I'm going to use a scalar, universal scalar, to do subgingival clean, I end up damaging the gums. So now I need to avoid damaging the gums. So what she made? She made Gracie curette, like this one. She made Gracie curate has only one sharp side, only one sharp side. This active side, which is the lower edge of it. And then she said, you know what? Because of this, I will keep the sharp side around the tooth and the non-sharp side around the gums. Like this, for example, guys. Guys, that's guys curate, as you see right now. Like this. This part is blunt. Look at this. This part is blunt. But the side, which is toward the tooth, is sharp. So the blunt will be facing the gums, so the gums will not be damaged. And the sharp will face in the calculus. Now I remove the calculus. Now, what about insertion angle? She said, I'm going to make the insertion angle between 0 to 45. 45, right? So you're going to make this lower shank, the relationship between the lower shank and the long axis of the tooth to be between 0 to 45. In this case, you will find, right, still the sharp edge toward the tooth and the blunt edge around the blunt side around the gums. And then you can insert it all the way below the gums. In activation, the activation between 45 to 90-degree angle, 70-degree is the ideal activation. If you look, guys, about these two positions, you will find both of them, they are active. This act is active. Why? Because the relationship right now between the lower shank and the tooth, 90-degree angle. And the relationship between the shank and the tooth more than 90. Like you can see right now, it's about, if the tooth like this, I would say 90 as well. Okay? So that's activation angle between 45 to 90, but insertion between 0 to 90. Maybe, guys, do you want to, guys, do you want a session for Gus Gracie curate and curettage? I can do this in details if you want. I can do it tomorrow if you like. Imagine tomorrow, maybe tomorrow. Let's think about we can do it tomorrow. Is she Gracie? I don't think she's Gracie. Okay, guys, only 6 minutes left, guys. So the answer now is they ask about what? Insertion angle less than 45. A alpha. Less than 45, okay? Question 4. What should be the relationship between the lower shank of the curate and the tooth surface when debriding tooth 1/6? Okay, guys, I said this right now. When debriding means it's active. In this case, the lower shank should be more than 45 up to 90. The lower shank should be parallel to the long axis of the tooth. That can be correct. It means like 90. Parallel, 90, yes, the shank. The lower shank should be at 45-degree angle, no. The lower shank should be perpendicular to the occlusal surface. Perpendicular to occlusal surface. No. The lower shank should be tilted toward the gingival margin, no. So, guys, what I think is the right answer now? The lower shank, guys, should be parallel to the longer axis of the tooth or parallel to the surface you remove, okay? A alpha. I will explain, guys, this to you again, okay? Maybe in tomorrow, if we can. While performing subgingival root planning with Gracie curate on the distal surface of molar, which of the following is the most appropriate technique to ensure thorough debridement without causing the surrounding tissue, damage to surrounding tissue? A. Engage the upper cutting edge of the Gracie curate at 45-degree angle to the tooth surface and use horizontal strokes. Why 45? Use the lower cutting edge of the Gracie curate at 70-80. Yes, that's perfect. This will be perfect. Angle to the tooth surface, employing longest weapon. Perfect. That's the one. Apply the lower cutting edge at 90? No, it should be less than 90. Using short, yes. Controlled, yes. Remove deep calculus deposit could be fine. But it should be 90. It should be between 70 and 80, less than 90. Position the lower cutting edge at 40 degrees. No, it will not remove calculus. Will be only scratching, but will not remove calculus. Use both the upper and the lower cutting edges. Upper and lower? No, we only use the lower edge. Because the lower edge or one edge only, guys, the cutting edge is only lower edge, only one edge in this curate. Okay, guys? Answer, guys, B, bravo. 3 minutes, guys. I will answer this quickly, and then we can explain later on. Okay, guys? Please, guys, write down the answer now, please, guys, quickly. I'll explain why. Guys, 3 minutes only. Now, the answer here is 4 or 5 years old. Why? Because the patient preschool. The key word here, preschool. Even without even looking at the X-ray, this is enough information to me, the word preschool, to say the patient is 4 or 5 year old. 6, 7, no preschool. A alpha. Joe is uncooperative. What will you do? If the patient asks cooperative, one, find out the reason of his behavior. Okay, that's good. So what? That's good. Apply, show, tell, do. No, we said, guys, we need to should do behavior management concept. Could be correct. Ask his mother to hold him. That's very bad. Bribe him. No, we need to find out the reason, guys. Why he's uncooperative? Because we need to treat the reason first. We need to address. Guys, answer quickly. Guys, please with me, guys, okay? Only 2 minutes left. A alpha, question 2. Joe has spontaneous pain in right hand side area. What is the most appropriate treatment for 245? 5-4. Guys, if you look, guys, at 5-4, you will find it's spontaneous pain. Spontaneous pain means the pulp is irreversible. Irreversible means you cannot do pulpotomy, but you can do pulpectomy, right? So, guys, pulpectomy and still see crown. Extraction, I don't think so, because even the radiolucency exists in there, not as bad as a sort of infection. So extraction will not be the best option, because radiolucency there, it's not as bad. So, I mean, like, it's not really sort of like an infection. So, guys, be bravo. How many minutes left? 1 minute. Okay, fine. His mother is upset. Guys, what's the guys answer this question? His mother is upset because she thinks that Joe's father lured him with sweets. How will you manage his concern? If this happening, guys, A, educate her regarding the significance of supervising Joe's diet. Good, but she's upset from his father, so you need to sort out this. Suggest to her that you talk to her ex-husband regarding her concern. Very good. Now you sort out her concern. Reassure her that Joe's father is caring about. She doesn't care. She hates him already. She will not be listening to whatever you say about him. Suggest that you talk to her ex-husband. No, she will not be talking to him. The best is be bravo. Last question. The 254 requires treatment. Given that Joe is uncooperative, what is the most appropriate management? Prescribe oral sedation. No, as dentist, as general dentist, we don't prescribe oral sedation. Right? Then proceed with nitrous oxide sedation. Yes, we love it. We can do it. Safe and nice. Postpone the treatment? No, we don't need to postpone the treatment. Answer, guys, be bravo. Proceed with treatment for the next visits. How was, guys, the mock exam? If you want me, guys, to discuss any of these topics, please let me know. If you want me to discuss more about behavior management or maybe about Q rate, aggressive Q rate, and all this stuff, Please, guys, let me know. How was, guys, the mock? Okay, guys, we're gonna start. We're gonna start this Monday, the course, guys, in this Monday. Okay. So, guys, we'll be seeing you on Monday. If you want actually me to loved it, guys. You loved it. I'm very happy, guys, with this. You loved it. Let me just get this one here. Was ready, you see, guys. Was a little bit stressful, right? To finish on time. Was really, guys, stressful. Yes, it's spontaneous. Guys, now, guys, you can ask me questions, okay? Guys, how was the mock, guys? And then now, guys, I can take your question now. We can spend 5-10 minutes to take the question. Wow, it's 2 hours already. How is this? Wow, how is this? 2 hours already. I think, guys, Facebook, guys, Facebook guys really getting crazy, guys. Okay, guys, I will be answering your question right now. Can please, guys, write down something so I check if I get from the Facebook app things can be updated? I hope so. No, I don't think it's updated, no. Okay. I will take, guys, whatever I have now in front of me on the screen, and then I will be updating after this. Okay. Yeah, I will be updating, guys, after this. Okay, Dr. Bidu. How pulpectomy and space maintainers only after extraction, right? Dr. Bidu, how pulpectomy and space maintainer? So no, you can do extraction, Dr. Fatima, and space maintainer. No pulpectomy and space maintainer, okay? Yes, space maintainer only after extraction. Loved it, loved the exam, doctor. I'm very happy for this. I'm very happy to know this, doctor. Grace curate, Dr. Sahel? Okay, I will do grace curate. Thank you, Dr. Shama. That's you love the mock. We do grace curate. Thank you very much, Dr. Shama. What was this question? Question 4 is mentioned. Why not? Yeah, because the pain is spontaneous when, as exactly Dr. Debika mentioned, when spontaneous pain means a reverse pulpitis. When there is a reverse pulpitis, you cannot do pulpotomy, but you can do pulpectomy or extraction. Dr. Natalie, very good mock. I'm happy. Please, guys, help Dr. Patel for question 19. Thank you, Dr. Dectroza, very much. Dr. Reza, always like Doctora. She's like, doctor. Thank you, Dr. Rosa. We want a lecture for Gracie Curate. No problem, Dr. Musa. Some question easy, but some was very tough. That's okay. This is how Dr. said at the exam. Dr. Bido, I have a question. In the mock tooth number was 5-5, not 5-4. It's 5-4, doctor. Treatment for 5-5 was asked 5-4, 5-4, doctor. Okay, Dr. Hajra? Please, you do the mock again. You will check it. I mean, like, look at the lecture of the mock, you will find 5-4. Please, Dr. Bido, I really want this, Dr. Debke. Very nice, you're very kind. Thank you very much. Very informative, doctor. I'm very happy, Dr. Harini, for this. I'm very happy you see informative. Yes, that's it. Yes, Dr. Jana. Same here. It was mind boggling. Okay. But enjoyed a lot, learned new concepts and how to think. Believe me, Dr. Anam, the more we go through the mocks, you will not only just know the answer for this question, you will be knowing the answers for all questions because you just apply the same concepts. You will find your mock exam marks will be improved a lot. It says to solve when you read and explain the mock, Dr. Bidu. Yes, Dr. I agree on this, Dr. Man. Please, Doctor, discuss about X-ray. I cannot find difference between right and left or below, upper and lower. Okay, Dr. Nadia, I already explained this one on one of our lectures. Already uploaded to you on Google Drive, right? It's called an X-ray, so interpretation. So please, if you go and check there, please you find it, okay? Otherwise, next time I'll explain about it. Dr. Samia, it was fun learning all the new concepts. I'm very happy for you, Dr. Samia, that you found this. Why not 5-4 pulpotomy? Not suggested, Dr. Harini, because the pulp has a reverse pulpite, spontaneous pain. Dr. Bidu, please help us determine age in X-ray. And yes, I will do the next time, next session then. No problem at all, Dr. So it is pulpectomy, yes. Dr. Sahel, doctor, I have just one question. Lateral excision, intrusion, valve involving fracture of bone. Do we give flexible splint? Depends on severity of bone. Most probably, if it just like the bone is not really complex type and it just simple one, we may still use flexible in the beginning because we give the tooth ability to move around nicely or gently. But if it's really the fracture really result in segmental movement, or really the bone is really not stable in place, in this case you must use rigid. Dr. Bido, space maintainers is after extraction. Yes. No, it should be only pulpectomy, doctor, not space maintainer. Only pulpectomy. No problem, Dr. Ramin. Dr. Bidu, is there sequence? You see, guys, that's the last I can see on Facebook. You must have asked more. You must have commented more, but this is the last. You see, I cannot see anymore. Dr. Bidu, is there sequence of condition agents? No, in this case, only place fluoride. If you mean condition agent for GIC, we can like 10% polyacrylic acid. We can explain this later on for GIC. But for if you ask about fluoride, no, that's the only one, doctor. Learn new concept today. I'm very happy for this. Let me, guys, refresh my Facebook and then see more comments. Well, Dr. Neshma asked when we have next mock. Okay, I will be announced right, but most probably next week. Okay, guys, I think that's the only thing, guys, I can see from my side. I cannot see more question than this. What is the top score? I need to check. We go through all. You can check by yourself as well. I think maybe you have an access to check this because we give you all the statistics, especially how much you scored every time and you progress. However, I will check today and then I will update. I will update you guys who's the top scorer for this mock. Thank you, Dr. Sahil. No problem at all. It's my pleasure. The mock up forces my mind, Dr. Jana, to be very alert, to rethink a lot. They are challenging. After seeing you correct in the last mock-up, I managed to advance from 55. Very nice. As long as there's a progress happening, even 5%, but that's great, doctor. I am motivated, although I still cannot practice in your course. That's okay, doctor. At any time, if you want to join the course, you can join, okay? If not, we're still here anyway. On my page, it was 55. I have a screenshot. Yeah, it could be Dr. Hajra then. Please also teach us also attempts exam according to classes. No problem, Dr. San. We have a lecture in the course guys to you. Difference between every cluster, so you can check this in the course. However, I'm happy to have a different session for it. Those are in the last questions. It says 1615, then when it is 45H. Look, the preschool, right? So the word preschool, what's called? Make him as 4 5 year old. I scored 36% in last mock, and I was sad about it. And today mock has scored 60%. I'm very happy for this progress. Was happy with the progress. Looking forward. Thank you very much. I'm very happy, Dr. Patel, for you. And then forward to maintain and do better in the next mock. Thank you, Dr. Bido, for your guidance. Thank you very much, Dr. Patel. Thank you very much. Thank you, guys. Thank you very much. See you then, guys. In next session could be tomorrow. I will announce for it. If you are happy, just put your name. If we see we have enough candidate can attend tomorrow, I will do it. Otherwise, we can keep our session on Monday, private session on Monday. Thank you very much, guys. See you all, guys. Thank you very much. Have a great night. Thank you very much, guys. I think there is no any more question, guys, from my side. I cannot see any more questions. Thank you very much, guys. Have a great night, every one of you. Thank you.